Hello everybody. I will say something today about functional constipation. So, um, Functional constipation is a very common gastrointestinal problem, and it is characterized by infrequent bowel movements and difficulty in stool passage. And the main symptoms of the disorder are hard, dry stools, bloating, and abdominal pain and discomfort. Pathogenesis of functional constipation is multifactorial. The Western medicine actually are trying to find the causes, but really up to today, the Western medicine cannot pinpoint the exact cause of the constipation. But we all know today that it is believed that the most common factors contributing to the disorder are psychosocial and lifestyle factors. We all know from the TCM point of view that disbalance, any kind of disbalance or disharmony in the body leads to dysfunction. With constipation, constipation is a problem that occurs in large intestine as an organ. But functionally, it is connected to other organs such as liver, lungs, spleen, and stomach. The most important thing in the whole treatment is to find the right clinical pattern. The right clinical pattern is bringing us to the right diagnosis, and this is really the main part of every treatment. And the clinical patterns roughly can be divided in the two groups which are excess or deficiency. I will go through a couple of clinical patterns. First one is excess heat. The cause of excess heat is mainly diet rich in spicy, greasy foods, alcohol consumption, and long-term emotional stress that affects the liver. And we all know that the liver is responsible for the smooth flow of the qi. So when liver qi is affected, it becomes stagnant. The most common symptoms are constipation with dry, hard stools, thirst, abdominal distension and pain, dark urine. And here we can see the photo of tongue. Typically, the body is full of heat, so the tongue will be red with dry yellow coating. Sorry. The second pattern is qi stagnation. Very often qi stagnation develops as a consequence of emotional stress. Very often we have a typical profile like somebody who is like a patient who is under a lot of prolonged emotional stress. Very often is that stress also affects the liver. Also physical activity, sedentary behavior, poor diet, or external pathogens like cold and damp. The symptoms are constipation with bitty stools, abdominal distension, pain, irritability, and mood swings. On the photo, we see the typical liver stagnation pattern. So the tongue is generally normal color, just for exception of the sides, and those sides of the tongue are the area of liver, so these sides are red and prominent. Blood deficiency, the cause of blood deficiency can be poor nutrition, stress, chronic illness, overwork, and in blood deficiency, the symptoms are pale complexion, dry skin and hair, dizziness, fatigue, anxiety, insomnia, and constipation with dry stools. Typically, in patients, we can see the dry and pale tongue. Yin deficiency very often a cause of yin deficiency is overwork or febrile disease, and it presents with dry mouth, skin, eyes, night sweats, and constipation with dry hard stools. Typically, the tongue in patients with yin deficiency is normal in color, but without coating and has cracks. In yang deficiency, very often people with yang deficiency are people who are working too much, especially who are physically working or are too much physically active, or have a diet which is rich in cold foods. In yang deficiency, the body is full of cold, so the patient will be feeling, will have a feeling of cold, will have cold limbs, abdominal pain, but which gets better with warming, and difficulty of defecation, but often with normal or loose stools, but also the feeling of incomplete evacuation. So this is the a tongue in person with a young deficiency. So the tongue is a little bit swollen, it's pale, and we see some other things like a middle crack that is connected to spleen, because very often young deficiency it means spleen young deficiency. So every treatment has to be tailored to the clinical pattern, and the goal of every treatment at the end is to balance large intestine, so to moisten and move stagnation from the large intestine. So we all know that acupuncture, as I said, is that functional constipation is a multifactorial disease, multifactorial disorder, and very important pathways are regulating the normal digestion. So definitely this is a disorder where brain-gut axis is very important, where connection between brain and gut has to be treated. So from the Western point of view, many drugs that people use in treating constipation are really not addressing the brain-gut axis. They are not addressing the central nervous system. So acupuncture actually rises as a kind of a logical choice, because acupuncture is really connecting central nervous system with the peripheral gastrointestinal tract. So I will go over some major points that are mostly used in all constipation protocols. First point that is always used in every constipation protocol is stomach 25. Stomach 25 is the front move point of large intestine. It is the point that balances digestion, regulates bowel movement. Bladder 25 is a backshore point of large intestine, and it's kind of complementary treatment to stomach 25, often used with stomach 25. Large intestine points, these are the really two strong large intestine points, always used in constipation treatments. So large intestine 11 is a Hussey point of large intestine. It clears heat, regulates qi and blood, and enhances the bowel movement. And large intestine 4 regulates wei qi and opens meridians. Stomach 36, also very strong point, is a Hussey point of stomach. It tonifies qi, stomach, and spleen, and balances digestion and bowel movement. Stomach 37 is a lower Hussey point of large intestines, and it promotes bowel movements and clears heat. Spleen points often used are spleen 6 and spleen 14. Spleen 6, also very strong point that tonifies spleen, stomach, kidney, and harmonizes the liver. and it supports yin, so it's used in protocols where we have a yin deficiency. And spleen 14 regulates qi, enhances motility, and it's often combined with stomach 25. So at the end, what I really want you to take from this presentation is that conventional therapies in Western medicine are really they target bowel function through dietary adjustments and pharmacologic therapy. Those therapies are often they are not giving us the long-term results, and they are definitely not addressing the underlying cause, and they are not addressing the brain gut axis. So acupuncture as an integrative approach really targets both peripheral and central mechanisms and offers comprehensive and sustainable management of functional constipation. Thank you.
Thank you very much, Andriana, for this informative presentation. Great work.